First of all, the fastest man alive, NASCAR driver Joey Gase. He'll be joining us. Aside from his busy racing schedule, he finds time to support numerous charities and nonprofit organizations. He has a personal connection that links his desire to help those in need, because at the young age of 18, Joey tragically lost his mother, Mary, to a sudden brain aneurysm. So we'll be talking about his journey and her journey on the call today. Also joining us is Dr. Alan Reed. He is the director of the University of Iowa Hospital and Clinic's Organ Transplant Center. Dr. Reed received his BA in biology from Hobart College, his MD from Cornell University Medical College, and his MBA in business management from right here at the University of Iowa Tippie School of Management. In addition to being a talented surgeon, I've seen him play many face-melting guitar solos on his Les Paul, so his talents are far and wide. Also on the call is Kim Burdikin, and Kim is a huge supporter of the university, a huge Hawkeye, and she is a liver recipient that she received at UIHC as well. She provided us with this quote today: "My transplant gave me my life back. My transplant gave my daughters their mother back. Back in 2000, my biggest fear was the thought of my daughters growing up without their mother. My transplant saved me." So Kim, Dr. Reed, Joey, welcome to Chat from the Old Cap.
Thank you so much for having us on.
Always a pleasure. So Joey, starting with you, I assume, you come from a racing family. I assume that you were probably born with your fire suit on, but how does a Cedar Rapids Xavier grad end up living in Charlotte and owning a race car team and driving a race car for a living?
It all started with my dad. He raced just at the local short track level at Hawkeye Downs. Ever since I can remember, I was in the garage with him and my uncle and his friends and my grandpa. And all I ever wanted to do was go hang out with him in the garage, work on the car, and watch him at the racetrack. And all I've ever really wanted to do was race. And I've been fortunate enough to be able to be where I am today, and I've had a lot of support behind me to do this. But I can't thank all the support from Iowa that's helped me get here.
That's great. And so, how did growing up in Iowa help prepare you for your career?
The one thing I will definitely say about the state of Iowa, compared to a lot of other states I've been to and lived in, is that Iowa is definitely one of the hardest working states as far as just people go in general. And I don't think we always we realize that. It's just the way we were born and raised, and the way we're expected to be. And the other side of that is I think the weather makes us tough as well, for sure. But, it's the way you're raised, I think. Everyone's built to do everything the right way. And if you don't do it the right way, it's not worth doing.
That's a great point. And for those of you that don't live in Iowa, Iowa Nice is a true thing. If your car breaks down, there will be several people to stop and help you. And Joey is actually driving right now. I don't think he's driving his race car, but that's why he's got his video off. So when he gets safely to the test, oh, there we go. We got you.
I just got stopped.
Stopped at your destination?
For now, we're good.
Okay. All right. Good deal. I'm glad to hear it. So, Kim, you've been a huge Hawkeye fan for a very long time. Where does your love for the Hawkeyes come from?
I've been an Iowa fan ever since, as long as I can remember. I was raised on a dairy farm in Muscatine, Iowa. That's about 40 miles southeast of Iowa City. And my parents were big Iowa fans, so cheering for the Hawkeyes was just something we did. We started doing that as kids. And Iowa doesn't have pro sport football team. So, I think we really latched onto the Iowa football team first. And then, of course, we got into the basketball. I married my husband, who is a huge wrestling fan. I had never been to a wrestling meet, but, Iowa knows how to put on a really good wrestling meet. So I've also become a huge Iowa wrestling fan.
Well, that's very cool. Let me share my screen here for just a second, and you can maybe talk us through this picture and
Okay.
what do we have going on here? Can you see
Yeah,
that?
right here. This is a picture. It just exemplifies our family. We're all Iowa fans. 2 of our 4 kids went to Iowa, and this picture was taken at the Orange Bowl. Back then, Jenna was I don't know if Tom was a student at Iowa at that time, but I know Jenna was. And we do travel to some of the bowl games. Dave and I have started traveling to the Big Ten football arenas. And so we've started to try. That was pre-pandemic. We haven't been to many games since the pandemic, but pre-pandemic, we have a goal of hitting all of the Big Ten football games at their location.
Well, very cool. And I know you're still sort of taking things very easy as a liver recipient. Will I see you at the wrestling meet tomorrow at 2:30?
You will not see me at the wrestling meet. After this phone call, I'm hopping in the car and I'm driving to Chicago, which is our other residence.
So if that's what I was going to ask you, what's it like splitting time between Iowa City or Muscatine and Chicago and Iowa? I've had a bromance for 1,000 years, but what do you miss most when you're not in Iowa?
Well, having a dual residency is a bit of a challenge, and it just takes some extra planning on my part. But moving to downtown Chicago was a huge adjustment. I had always lived in Muscatine, Iowa, in a house with a yard. And in Chicago, our condo is on the 44th floor of a high rise. In Muscatine, I hop in the car and run my errands and go pick up my groceries. But in Chicago, we walk everywhere. So when I go to the store in Chicago, I get only what I can carry. When I'm in Chicago, I miss my Iowa family and friends. My mom and dad still live at home here in Muscatine. Dad's 94 and mom's 86. So when I'm in Chicago, of course, I'm worrying about them. But I also miss the Iowa Donor Network volunteer responsibilities or opportunities that I get. But the great thing is the drive between Muscatine and Chicago is only 3.5 hours, as long as it's not rush hour. So the drive,
famous Chicago rush hour.
Yeah, Chicago
you should
rush
have
hour.
Joey driving. You might get there a little bit earlier.
Well, there's cars in front of you. You can't go.
True. Rush hour is not a good name for what's
not fun. No.
Well, very cool. So, Dr. Reed, kind of the same question for you. How did someone from Long Island end up leading one of the greatest transplant centers in the country right here in Iowa?
Before I answer that question, I'm going to tell you what the best part of Kim having 2 homes is. I don't know if you can see this picture. That the best part about Kim having 2 homes is she can't always use her killer seats. And she is so generous that she shares them. And this is me and my daughters at the Iowa Penn State game a couple of weeks ago. And it's wonderful to sit in her wonderful seats. So yeah, I'm originally from New York, but I've had a few stops in between. As you mentioned, went to college upstate New York and went to medical school in Manhattan. My first job was in upstate New York, and then I was at the University of Florida, go Gators, and then was recruited here. And it turns out that Iowa has always been at the forefront of a lot of things in medicine. So I remember being in medical school and reading an article about some place in Iowa City being the first hospital to have an electronic medical record, where you could write orders in a computer and pull up x-rays on a computer. And I'm like, where's Iowa? And no, seriously now. And Iowa, after building a huge program at the University of Florida in the top 5 in terms of numbers, gave me the opportunity to build a transplant program the way I thought a transplant program ought to be built structurally. From the hospital side, from the College of Medicine side, all the pieces were here. And it was a great opportunity. to move to a part of the country that I loved because I did my transplant fellowship in Madison, Wisconsin. Fell in love with college towns. Thought the Midwest was just great place to raise our kids, who at the time were 2 and just born. Those 2 little girls we saw in the picture. And it was just an opportunity to do something unique and different.
That's great, and we're very glad you're here and you landed here. What surprised you most about Iowa or about UIHC in general since you've been here?
Yeah, so here in a very bucolic college town, there's a world-class medical center with really, really dedicated, hardworking people. We've got an incredible team, and I think the people in the state of Iowa are extraordinarily lucky to have an organization like this in their backyard. There's nothing that they need that they can't find here in terms of healthcare needs, cutting edge medicine, dedicated physicians, wonderful nursing and support teams. It's really remarkable. And it really surprised me because to those of us who grew up on the coasts, you know, this is flyover country until you get here. Until you realize the type of people who live here, the type of dedication that these folks have, and what a wonderful place it really is. I mean, we came and it's been 15 years now.
That's great. That's great to hear. And I think all of us would agree with you that it is a truly special place. So we're glad you're here, and thank you for sharing that with us. So organ donation is definitely a journey, and there's many people involved and healthcare people involved. And so I'd like to start with where that journey begins, and that begins with the donor. So Joey, your mom was a donor. Tell us a little bit about her.
Yeah, my mom, Mary, she was relatively young when she passed away. She was 44. I was 18, about ready to graduate high school, getting ready for prom. My sister was in 8th grade, and she was a very loving and caring person, and perfectly healthy as far as we knew. And she was someone that worked really hard to stay healthy. She worked out all the time, ate super healthy all the time, was always on my case and my sister's case to make sure we were eating healthy and not drinking a bunch of soda and pop and all those different kinds of things. But unfortunately, she passed away of a sudden brain aneurysm. And at that time, you know, it was something I had never even heard of before, and never even knew was a thing. And we don't know how long she actually had it, or if it was sudden or not. Unfortunately, she suffered from very severe migraines most of her life. So the day she passed, she acted pretty much completely normal. She complained of a small headache, which was nothing new, and I set up her the PlayStation so she could watch a movie before I left, and asked out my prom date that night. And unfortunately, when I came back home, she was suffering. So, but hours later, we ended up at Mercy Hospital, and then she was transferred to the university. And down there, we found out it was the brain aneurysm, and so after that, we found out she was gone, unfortunately. And you know, it's it was something that was super unexpected. And you know, I was just 18, and my sister was in 8th grade, and you know, we never thought we were gonna about ready to lose her mom. But you know, luckily she said to donation, and it was a thing too where we never had that conversation about organ donation before. But the one thing she did talk about before was that she always wanted to be a blood donor. And it was kind of funny, I guess. She's a very short and a very tiny person, and so she actually never weighed enough to go donate blood, so she couldn't go do that. And her driver's license was left at home, so we couldn't use that as a tool to see if she was a registered donor. But we knew she wanted to be a blood donor, and also she was just a very loving and caring person. She would want to donate. So we said yes, and later we found out she was a registered donor when we found her driver's license, which meant the world to us, and that she was able to help save and improve the lives of 66 people, which was amazing. We thought it could be 2 or 3. We didn't really know, how many people one donor can actually impact.
That's, Joe, I've heard you tell that story many times, and it still is, an incredible story to hear. And what you and your family have done for others is truly amazing. What you've done with your career since then is really amazing. So thank you. So again, this journey continues to the recipients, right? Your mom was able to help 66 people and save the lives of others. How did you find out that you would need a liver transplant? What was that journey like for you?
Oh gosh. It was really bizarre. It was back in April of 2000. I was a single mother and I had 2 daughters, young, 9 and 12. And I think there's a picture, if you have the picture of me with my daughters, this would have been one of the last pictures we took before I got sick. And, I wasn't feeling well for a few days. And once I became very jaundiced and started to become confused, I was rushed to the University of Iowa Hospital and Clinic. And after a battery of tests, I was diagnosed with acute liver failure. We would soon learn that I needed a liver transplant in order to survive. So I was placed on the transplant waiting list. And we also, over the next couple of days, learned about living donation. I had never heard of a partial liver transplant. So my sister, Kay LaRue, who is in this other picture next to the picture of me with my daughters, my sister was a match. So it was possible that she could be my donor. Well, my health deteriorated and I had been at the hospital now for 2 weeks, and I became a status 1A candidate on the transplant waiting list, which means I went to the top of the transplant waiting list, also indicating that without my transplant, I was going to die. So that's when I really started thinking about not wanting my daughters to grow up without their mom. So my sister and I were rushed into surgery. We're both under the anesthesia. And then the transplant team was notified that there was a liver in Michigan that was allocated to me. So they went and recovered the liver and brought it back. And after the 10-hour surgery, the transplant was a success. So imagine my shock and confusion when I came to and I didn't have my sister's liver. Gosh, I was thrilled that Kay didn't have to go through that risky procedure. The University of Iowa had performed 2 living liver transplants prior to the one that we were in the process of doing. And I also realized that there was a family that was completely devastated. We were told that it was a young male from Michigan. That's all I knew. And it was hard because I knew that they were going through a really difficult time.
Yeah. What was that like being on the transplant list? I think you once told me that it was like skydiving and you didn't know if every time the phone rang, it was like skydiving. You didn't know if your parachute was going to.
Yeah. I did feel like that was it because, you're there and you just don't know if, and it's also like the lottery, am I going to get that transplant? And the thing about my sister doing the partial, I was so sick, they really didn't want to do a partial liver because they didn't know if I would pull through while the liver regenerated, which it needed to do. I was also so weak. I couldn't even walk or feed myself. I had gotten so sick. My kidneys had failed, so I was on dialysis. After the transplant, I was on high doses of prednisone. So I had these freaky hallucinations. I developed pneumonia. So needless to say, I spent several weeks in the hospital, but eventually that roller coaster ride that I was on started to smooth out, and I eventually went home. I went home taking 43 pills a day, and I weighed 84 pounds. So I spent the next year recouping. It took me about a year to get back. I can't say normal because I don't feel like after a transplant you're ever normal. But I spent the first year in and out of the hospital, and things got better after the first year. As a transplant recipient, I take anti-rejection medications every day for the rest of my life. And as a transplant recipient, taking anti-rejection meds cause you to have a suppressed immune system. So the last couple of years have definitely been two of my most challenging years, because we are warned you don't want to get sick, because your body can't fight off these infections and viruses like most normal people do. So navigating the last 2 years and currently, it's been a challenge, but I feel like we've got a great transplant program at the University of Iowa. Even though I'm in Chicago a lot of the time, I still do my transplant follow-up with the University of Iowa. They're just a great team, and I think it's really important that we have our communication with the doctors there and the patients, such as myself, knowing what's the best way to navigate times like today. That could be a whole nother podcast.
It could be, it may be. Be careful what you wish for, but that is an incredible journey that you've gone through and continue to go through.
It's a blessing. It's just a blessing and a miracle that I survived.
Yeah, well, we're so happy that you have. We know that I'll get to all the things you've done post-transplant here in just a second, but you've certainly made a difference. So, Dr. Reed, going back to you here, our transplant 101 here. How does a liver from a young man in Michigan end up in a woman at University of Iowa hospitals and clinics? What is that process like?
Yeah, well, before I address that, I've been doing this long enough, Tony, that in show business, they say never follow a kid or animals. I've given enough talks to know never follow a donor family or a recipient. Their stories are so compelling that no matter what I say, people aren't going to pay attention. From Joey's family's point of view, sometimes it's the only way to make sense of a senseless event, to donate. It brings hope and light, to a hopeless situation. From Kim's point of view, it's what we do. It's why we do it. We call the liver transplant sometimes the Lazarus operation. It brings people who are on death's doorstep back. So whatever I tell you now, people aren't going to pay attention to. But that said, because you asked me, I'll tell you, and it changes. So how does a liver, in Michigan get to a woman in Iowa? Well, as a community, we've come up with a whole bunch of allocation rules. Those rules change over time. They've recently changed a couple of years ago, and not to the benefit of Iowans. But these allocation rules are generally agreed upon by the transplant community and lay people and interested parties, and they differ from organ to organ. Since we're talking about livers, we'll stick to livers, and generally livers are allocated within blood type and body size to the sickest people first. And there's a mechanism by which that's calculated called the MELD score, the Model for End-Stage Liver Disease score. And it's also over a certain geography. That geography has broadened over the years. And at the time, Kim was in her blood group, was probably the sickest person within a certain geography. And these algorithms that determine who's the sickest at that time within a blood group are housed in Richmond, Virginia, in a group called UNOS, United Network for Organ Sharing. And they're a contractee to the federal government. And we all belong to this membership organization. We create these algorithms, sort of together. And pardon me. So these algorithms exist out there. In a parallel universe, The country is broken up into what we call donor service areas. Iowa essentially is a donor service area. Michigan is part of a donor service area, and OPOs like Iowa Donor Network, who you work for, and many of the people on the call work for Iowa Donor Network, are in charge of not only educating the public about organ donation, but organizing the organ donors and making sure that as many organs from a particular donor that can be used are used, and that they're allocated to the people on the list according to those algorithms. And so when a donor is identified at a hospital, an educated and trained person from the organ procurement organization or OPO goes there, assesses the donor, gets consent from the family, and runs these lists and offers the organs out to the transplant centers at which these patients are listed. Kim was listed here for her liver. A call from Michigan came to this transplant center. I wasn't here at the time, but it was offered and accepted. And there may be a liver going to Iowa. There may be kidneys going, one to Michigan, one to Denver. There may be a heart and lungs going to different centers. And it's the job of the Michigan OPO coordinator to coordinate all those teams coming in to wherever the donor is at that hospital, organizing that operation. The operation occurs in a very serious, courteous, and environment. The organs are removed, they're stored and put on ice and sometimes on a pump when appropriate, and flown back to the hospitals where the patients are to be implanted. When those organs are taken out, Kim would have been brought to the operating room at the University of Iowa, and a different team would have started that operation and the transplant completed. So it's very complicated, very complex, requires a lot of interactions, a lot of professionals being involved. Kim would have been in the hospital at the time here. She was sick. Sometimes patients are at home and they need to be called in. So there's a whole set of dedicated coordinators on the transplant center side who would have done that. That's more common for kidneys, and sometimes liver recipients are at home, sometimes they're in the hospital. So yeah, it's a very complex dance that is done every time somebody is transplanted. Last year, I think there were 35,000 transplants done in this country of various types, and that dance is done many times a day.
Yeah, and that dance, as you said, is quite complicated, and especially when you're talking about some major surgeries happening, multiple times from one donor all over the country. So thank you to your team, and thank you to Iowa Donor Network, and of course to donors and their families. Dr. Reed, I have this picture of you with your crew. If I could just share that here in a second, and you can maybe talk us through some of the folks that make donation possible on your end. If I can get that pulled up here. So who's this crew here around this dog?
It's either going to be a white dog or a blue dog, whichever picture you put up. All right, so yeah, this is an interesting picture. So this is a very, very small part of the crew. We've got a huge team. There's about 70 to 80 people in the Organ Transplant Center. The picture on the left actually was one of the first pictures we took when the pandemic started. Everyone was very proud to show off their yellow helmets. The picture on the right is actually a patient who received a living donor kidney transplant. We'll focus on the patient on the left, the picture on the left for a minute. Those are many of our medical assistants, a couple of our social workers, but we've got a huge team of dedicated nurse coordinators, social workers, financial counselors, psychologists, office staff, patient navigators, all who come together to pull together to get the patients through the evaluation process, through listing, through waiting, and through transplant. The dog. I'm going to let Kim talk about the dog, because Kim is the critical person that brought the dog, whose name is Blue, B-L-U, to us. So if it's okay with you, I'm going to let her talk about the dog that proudly sits in our organ transplant center.
Right. Okay. Well, most of you are probably familiar with the Hawkeyes that you see around Iowa City. Well, in Chicago, they did a special fundraiser supporting fallen police officers, and Paws Chicago, which is supporting, the animals. So my husband and I, Dave and I decided that we were going to sponsor one of the dogs. I think one year they did cows. I had to pick up the dog. It comes just kind of like a white plaster type shell. And my brother, Jim Hetzler, is an artist. And so between the two of us, we decided how we were going to paint the dog. And then the dogs are put on display on Michigan Avenue in Chicago. So Blue, as he became named, sat on Michigan Avenue for a couple of months before we had the opportunity to either auction off our dog or we could purchase our dog. So we decided to purchase the dog, and I got a hold of Dr. Reed and asked if he had a place where Blue could proudly promote organ donation. He's got a little Donate Life vest on, and he's decorated with all kinds of green ribbons. At one time, when we first put him on Michigan Avenue, he had a green ribbon that actually hung from his mouth. I think that green ribbon lasted about 2 or 3 days on Michigan Avenue. Somebody apparently snagged it and ran off with it. So we didn't do that. We did another dog a couple of years later, and that dog is called Dee Dee for Donor Dog, and he sits at Iowa Donor Network. It's been a fun project for us to support.
So to answer your question, that dog was generously donated by Kim and Dave Burdikin. He sits in the organ transplant center 1 or 2 weeks a year. He goes down to the lobby of the hospital for Donate Life Month and sits in the front lobby proudly showing off his colors for everybody to see.
Yeah.
I pet him every day on the way in and the way out. He occasionally gets dressed for Christmas. He has a mask on for the pandemic. Yeah.
Yeah. I've seen him with a stocking cap and scarf.
Yep.
Yeah, I miss Blue. I used to talk to him every day when he was in the Iowa Donor Network offices. Say hello and goodbye.
Yeah, they all borrowed him from time to time. Now they have their own dog. I understand. So
they have Dee Dee.
That's great. So the next sort of step in the journey, and Joey, I'll go back to you here. I know you've met some of your mom's recipients. Who have you met, and what was that like for you?
Yeah, we've been fortunate enough to meet 2 of my mom's recipients so far. One was her kidney recipient, and the other one was her liver recipient, Maggie, and Jordan was her kidney. And to be able to meet them was, it's a crazy feeling, but it was really good to be able to see, how good of people they were, and how thankful not only they were, but their entire family. And knowing that your mom was still able to live on through them, and knowing that, if she was not an organ donor, that they still may not be here today is a very crazy thought and feeling. But what I didn't realize, or think a lot of, everyone thinks about the one person that they're helping directly, but what a lot of people don't realize or think is how many more people they're really helping through the ripple effect. So each person on this world knows, hundreds or thousands of different people. And with that, you're able to know that they had effect on all these people now. So they're still able to help their loved ones and their friends, and still have that relationship with them. And that was the biggest thing that really made me realize, was able to meet them in person and realize that, which was really cool. And it's always a good feeling knowing that you helped, that she was able to help someone that truly cared and truly thankful for their gift, and that you're helping a good person.
Yeah, that's great. And I met Jordan too, your mom's kidney recipient. I think he's a teacher, right? He like works in a preschool. So talk about all the
Yeah.
kids that he is, affecting because of your mom's gift. That ripple effect you mentioned is alive and well. So we'll just talk Maggie and Jordan in particular. How have their lives changed since your mom's gift?
Maggie, she's been doing great ever since my mom's gift, and it's a crazy world and small world, and Maggie and her husband were actually season ticket holders at Iowa Speedway before she ever knew who I was or my mom or anything, which was really cool. And maybe my mom and Maggie crossed paths at Iowa Speedway, which is pretty cool to think about. And she always told us, or Maggie told us, that she was never actually told, who was her donor until we met. But she always had the feeling that it was my mom and that story, because she just heard about it, obviously, from being a big volunteer at Iowa Donor Network and on the news. So that was pretty cool how that worked out. And Jordan, he's had some setbacks since, but Jordan, he's a huge fighter, and unfortunately, he's had problems ever since, I believe, 4 years old from cancer, and then that's what led him needed the transplant. And I believe my mom was either his second or his third transplant, and he's on the list again, unfortunately. But it's funny how you say he works in daycare. Because of all the problems he had since he was at a very young age, it stopped his growth. So a lot of people say I look young for my age, but Jordan, he looks really young because he's not very tall and he's not really big, but he's full of personality, and he's just thankful for everyday life, which is so cool to see. It doesn't matter if he has to go the dialysis every day or whatever it might be. He never complains, not once. And I think that's something that we can really learn from a lot of different people.
Well, and Jordan you nailed it. He's small but mighty. He's
Yeah.
He is a character for sure. So, and Kim, on the other side of that, and if anybody in the audience wishes to submit a question, you can use that Q&A button down on the bottom of your screen, and you can start sending those in. But Kim, I mean, look at what you've done since your transplant. I mean, you've been on the Rose Parade, you do the Transplant Games, you taught hundreds of drivers ed courses. How has your transplant changed your life, improved your life?
Oh, well, I went from getting my will in order, which was the very most challenging thing I've ever been asked to do. When I was in the hospital, they just kept saying, you've got to have everything in order. And as a single mom, boy, that's a really challenging thing to face. Especially, I was just 39 at the time, and I felt like I had a lot of life left to live. So really, ideally, what I feel most blessed about was being able to raise my daughters. They've grown into, beautiful young ladies. It's just been a huge blessing. And in 2002, a couple of years after my transplant, I married Dave, and my life was further enhanced with two amazing stepsons. I then became very involved, like you said, with Iowa Donor Network, and I'm starting my 9th year on the IDN board. They're going to get rid of me someday, but I'm currently the secretary, so that's a huge honor. In 2006, when we went to the Transplant Games with Team Iowa, we started the Iowa Transplant Open golf benefit here in Muscatine. For 10 years, we had an Iowa Transplant Open fundraiser to support and raise funds and awareness for organ and tissue donation. In 2014, Iowa Donor Network, that was when they sponsored me to ride on the Donate Life float. And that was kind of one of those things on my bucket list. I've kind of decided as a transplant recipient, not having a bucket list is not you really don't want to have one because your life can change drastically very suddenly. So I just kind of have a wish list, not really a bucket list, but being on the float was huge for me because I really wanted to be able to showcase my donor, and they did allow me to hold a picture of Stephen, and I could honor his family in that way. In March of 2000, just as the pandemic was breaking out, we became grandparents. So I'm a proud grandma, and I'm happy to announce that we have 2 more on the way. Both are due in July, about 5 days apart. So yeah, very exciting.
Incredible. Just talk about Stephen. What was it like meeting Stephen's family, your liver donor's family?
Oh gosh, Stephen's family and I, we started out writing back and forth. This was before we we weren't allowed to know much about each other. When I wrote letters to them, I could tell them my name. I could send them pictures. I just couldn't say anything about my last name or where I lived. Back in 2000, yes, we had the internet, but we didn't have the searches we have now. So I'm sure it's very limited now, but it would be probably a lot easier to find out more about them. But then they wanted direct contact with me, and they were in Michigan, we were in Iowa. So we would talk on the phone. I'd call them at Christmas. They would, call us on Thanksgiving or whatever. We've exchanged a lot of gifts, but it wasn't until the 2006 Transplant Games that we were both attending, and the games actually coordinated our meeting. And it was emotional. I mean, oh my gosh, they were crying, we were crying. It's just it's a blessing, but it was also their reminder of their loss, but how cool it was that a part of their son is still living through me. So, Stephen and I have kind of this partnership. We're keeping each other going. But yeah, it was really cool. In 2008, I met his brother. His brother lives in Hawaii. So I've been to Hawaii a couple of times. Jenna, my oldest daughter, lived in Hawaii for a short period. And so it was great to meet up with Stephen's brother, Chad, at that time. And of course, whenever I participated in the Transplant Games, I haven't received very many medals, but if I do, I always made sure it went to them because I can't pay them back for the gift that they've given me, and they've given me my life. So.
Yeah, that's amazing. And, with Joey being a donor family and you getting your life from the donor family and all the things you've done, that ripple effect keeps coming up again. So thank you. Dr. Reed, University of Iowa has one of the most successful transplant centers in the country. Is it all Iowa nice? Is it all of our great physicians? Why are we so great?
I got nothing after that, Tony. Come on now, you know better than that. The only thing worse than following, a kid or a dog is listening to a donor and recipient family meet. No, it's not the doctors, it's the team. We've got a killer team. We've got wonderful nurse coordinators. We've got, fabulous physicians. The physician component of our team is what I'm most proud of. Our nephrologists and our hepatologists, our liver doctors are world class, and we've got plenty of them. We've got great social workers, financial counselors. I mean, people don't realize it's not as easy as just showing up and getting a transplant. In this complete and utter lack of what we call a healthcare system in our country today, and I'm going to say that again so people hear me, complete and utter lack of what we call a healthcare system in our country today. It's so incomplete, and it's so hard to navigate for people to understand getting healthcare coverage and getting referred to an institution and following through. The burden of disease is bad enough, but the burden of trying to deal with the bureaucracy of healthcare is so hard. We've got wonderful professionals to help them navigate through and understand their coverage. And if they don't have enough, where to get it so they can be successful. Social workers to help them understand how they can fill out their their wills and other things, clinical psychologists to help them understand how to cope, medical physicians to help them deal with their medical problems and care for their medical problems, nurse coordinators who, geez, are the linchpins of the transplant process from pre and post. They're really the and medical assistants. Geez, I never really understood the role of a medical assistant, but now I realize they're the everything. They touch every part of what a transplant patient goes through, at least in our program, from gathering the data to setting up the appointments to making sure they follow through. We even hired a new sort of role, what's called a transplant navigator, through a philanthropic gift, people whose sole goal is to call our patients and make sure they're getting through the system properly, because even though our system is set up to maximize success, the healthcare system is so hard to navigate. So no, Tony, it's the team. The surgeons, I mean, I think we do a real good job. We're well trained, but to some extent, often we do the technical part. It's a lot of fun. I have to pinch myself because I get paid to do what I do. It's a lot of fun, but it's a team from beginning to end, and that's why we're so successful. And because leadership at the time, Dr. Robillard and Dr. Weigel, who recruited me, allowed us to build this transplant center with a vision to create a team and not worry about the finances of the team. See, most medical centers are so, structured in such a way that the hospital's on one side, the medical center's on another, and their departments. But ours isn't sort of built in silos like that, and nowhere does the silo work. It doesn't work any better than in Iowa for people to understand the silo concept. But we're very flat, across our organization, and the patients in the middle. That's what really allows us to function and get such good results. Patients come here, they don't really care about your internal problems. They just want to come and get their care delivered in one place at one time. We try very hard to meet that need.
That's great. That all was great and makes total sense. So we've got a couple questions for the audience here as we wrap up in the next few minutes. Dr. Reed, while we've still got you, what impact has COVID had on the transplant journey?
Jeez. Well,
answers, though.
I don't know that I can answer that question. At first, we were concerned about using organs from COVID positive patients. We're learning a lot about that. And after about 21 days, 4 or 5 weeks, we now know that we can use those organs safely. The biggest impact COVID has had is on staffing in the hospital, filling the hospital ICU beds, not being able to have enough staff to do transplants. It's killing everybody. So the biggest issue with COVID hasn't been with donors. It's been with either our patients getting COVID or having enough room in the hospital to get patients in and do transplants. It's burning out the team. It's burning out our nurses in the operating room, and we're losing a lot of staff. So that's where it's hurting us the most.
Actually, the interim, Kim Hunter, the interim director for UHC, was on an episode of Chat from the Old Capping Nurses Week last year and mentioned a lot of those things. So thank you for forging on and dealing with this, and clearly, continuing to save lives. Kim, question for you. Someone asked about Transplant Games. Is it a athletic event? What do you have to do to be on the team?
Okay, the Transplant Games is an Olympic-style event for people that have had a transplant, but it's also for living donors. They have events that living donors can participate in, but there's a lot of cool stuff for donor families. They will have a donor memorial service where they'll have a slideshow of all of the donors, the people that have submitted pictures. There's just all kinds of, there's bowling, there's badminton, there's track and field, there's golf, team sports like basketball and volleyball. I'm not real athletic, so I'm a better cheerleader than I am an athlete. So I haven't medaled very much. I did get a medal a couple of times in the 1,500 meter race walk, which is just walking around that track a whole bunch of times.
I have been to the Transplant Games, and I can tell you that the athletic competition is down in the totem compared to the camaraderie and fellowship. And
oh my gosh, it's so fun to be a part of like Team Iowa. We're like a family together. We get together, and the games are only every other year. We haven't had them, of course, the last year. They're supposed to be in San Diego this summer. So we'll see what happens. I think they're planning on going ahead with it, but we will not, unfortunately, we won't be able to go because it's also the week that the grandbabies are due.
okay.
So we have to sit this one out.
So, and I've got a couple more questions, probably one more question here for Joey if you're still on, but there's a few questions coming in about people that want to be living donors and want to know some percentages. I'll send you two places. One, iowadonornetwork.org. That's where you can find out all kinds of stats, and then you can contact the University of Iowa Hospitals and Clinics Organ Transplant Center to find out more about what it takes to become a living donor. Thank you to anybody that is willing to do that. As we mentioned before, if you don't have a Y next to your driver's license, next to donor, you can go to the Iowa Donor Registry and sign up online, or next time you get your driver's license, you can sign up there as well. So Joey, I've had some people say, you put donors on your car and, work with donor families. Do you intend to do that again this year in the NASCAR series?
Yes, we will be. We'll be doing that starting in Fontana. We'll be working with One Legacy at Auto Club Speedway, which is in Fontana, California. And then we'll be doing it the following week with the Nevada Donor Network at Las Vegas, and many other times throughout the year as well. I'm sure we'll be teaming up with my favorite Iowa Donor Network again, possibly at Hawkeye Downs, and hopefully somewhere at Kansas or maybe Road America. Unfortunately, since COVID, we haven't been back to Iowa Speedway, but hopefully we'll get back there here soon, and maybe even Knoxville. The Truck Series races at Knoxville, Iowa now, which is a dirt track, and that'd be really cool to do there. But we'll definitely be having Handprints of Hope events and honorees on our car a lot again this year.
Excellent. That's been part of many of those, and that is a very emotional day. And if anyone's ever been to a NASCAR race, the drivers are as busy as they get. So Joey, thank you for always taking time to meet with fellow donor families, with recipients and their families. It's truly a once in a lifetime experience for them. A few other questions that have come in. Again, I'll direct you back to Iowa Donor Network if you want to get more information about the Transplant Games. They've got staff that are assigned to those. You can reach out to them. You can also reach out to me. I've emailed everyone that's been on the call today, and I can help direct you in the right place as well. So we are about time as far as our chat from the old cap. I want to absolutely thank Dr. Reed, Kim, and Joey for being on our call. Your lives have been saved. You are saving lives. And what you've done with the gift is truly amazing, and the ripple effect just continues to grow. I've been here 3 years, and I'm finally getting to reunite with some of you, which has been fantastic for me as well. So thank you for everything that you do. Thanks for all our audience members for participating and asking great questions. We'll be setting up a follow-up, and we'll be sending out the recording in the next few weeks. So as always, on Iowa, go Hawkeyes, and thank you very much for your time today.
Thanks for having us, Tony.
Hawks, thank you.
Thank you, guys.